some of you probably heard of medical billing before. It's been around for a long time. My wife and I did it for years back in the early 90s, right here out of our home here in Fort Worth. And it got to be so successful, we started training and teaching and supporting other people. And now we have literally hundreds of people from coast to coast doing this business, helping doctors to collect the money that's due to them from the insurance companies and from the government agencies. So that's what the business is all about in a nutshell. But folks, wait till you see the potential in this.
Absolutely. And again, let me remind everybody that throughout the presentation today, simply ask some questions. You've got us here for the next about 50 minutes now. So please type in your questions as we go through this. What we're going to do, first of all, we're going to kind of run you into it from an angle of even why would a doctor want to even outsource to you. We're going to share with you why a doctor is going to want to outsource to you. I mean, so some of you may have seen this already. You may have heard why doctors want to outsource to you. Maybe this is your first time. You know, for some of you, you're going, what in the world, Patrick? Why would a doctor, any of these doctors, want to outsource their billing? And we were just talking about that with the new service that ABS is rolling out here at the beginning of 2021. Why would a doctor want to do anything outside their office? But gosh, with this whole pandemic, they're doing a lot outside of their office.
They sure are. I guess more and more people are realizing that doctors are struggling right now to see enough patients to generate the kind of revenue that they were used to back in, you know, February and March of this year. It's kind of gone downhill because a lot of doctors are not letting the patients come in, or at least they're having to, you know, have them wear masks and take their temperature and be more cautious about everything, which is fine. But the doctors want to know, is there a way that I can get anything out of my office that I don't need to be involved in? And folks, they're not good business people. Any of you on here who've worked with doctors, would you admit that doctors are not good business people? They don't know how to manage their practice as a business and show profit. I mean, it's all about bottom line. They got to make money, or they can't pay their staff. They can't add, you know, new staff. They can't buy new equipment. It's all about cash flow. Every business is, including ours. So why would they outsource it when they could do it inside their office themselves? So let's talk about that. Here's one of the reasons right here. Eric, talk about that.
You talk about wasted money and what's being spent on just administrative and billing expenses. Folks, if you think about this, just 24 cents to the dollar, that's 24% of every dollar that doctor is making going out in administrative and billing expenses. So you got to be thinking about that as you're thinking, why would a doctor outsource? Don't they do billing in their own office? Well, that 24 cents actually increases when you add a staff member on top of some other things that are going on. So whenever it gets down to it, we're going to show you a chart here in just a moment that the average about what you would be charging a doctor to do their outsourced billing is going to be actually in the single digits. It's going to be 6, 7, 8%. So we're going to show you ways in which you can help that doctor discover that they are spending 24, 25, maybe even 26% of their revenue just on billing and administrative expenses. And that's been documented, obviously, through the New England Journal of Medicine. Patrick, that's quite more than the 6 to 7% that most of our licensees are actually charging the doctor to do bill.
Yeah, you'll be charging the doctor a percentage of all the money that you actually collect for the doctor. So let's say you bill for the doctor $100,000 and maybe you only collect $95,000 of that. Just multiply that by 6 or 7%, sometimes 8. It depends on the doctor, the specialty, their volume, a lot of different things. But in this chart we came up with here, you'll see at the top there that we've actually worked in there 6% fee for you. So look over on the far right, you see that $31,200 there. That's what you would be billing the doctor for after you've collected the money for them, and he would be paying you the $31,200 to do the billing. Now that's based on the numbers that we plugged in here. Folks, let me encourage you to get the handout that's over there in the handout section of GoToWebinar there on your screen. You should see a PDF file there of these slides, and you can open that slide up and look at it more carefully. But bottom line, look down at the bottom. That $31,200 is all you'd be charging the doctor. That's all they'd be out for outsourcing the billing to you. And yet inside their own office, they could be paying up to $65,000 to do it inside their own office because of all the costs that you see that's involved in that. Doctors don't realize probably that they're spending that kind of money, but they are.
Yeah, absolutely. And another reason that doctors are losing money is because of high rejection rates. These are claims that are processed but are not accepted either by what's called a clearinghouse and or the insurance companies themselves. So, this number right here is a very high number. And so one of the advantages of getting the billing outside of that doctor's office is to reduce the claim rejections. Ours, Patrick, as you know, and what we hear back from our licensees is less than 2%. So you go from 35% down to less than 2%. And folks, you can start to see now why a doctor would at least consider to start outsourcing the billing outside of their own office.
Yeah, even if a doctor's rejection rate was not that high, let's say theirs is only, 8% rejection.
Right.
Ours is 1/4 that, less than 2%. Right. Now, folks, we know that because our system is one of the only systems out there that has the clearinghouse built in. Usually, you have to outsource your claims. You send them to a clearinghouse, which is a third-party company that scrubs them clean, makes sure everything's fine, and then forwards them on to the insurance companies. We do that inside of our cloud-based system. We're the only company that I know of that does that, right, Eric?
Absolutely, you bet. Yeah, and with the specialized technology that's coming out for doing the billing, some of the other services that we have on tap for you to share with you this afternoon, you're going to find out that a lot of what we're going to be sharing with you is because there has been a need, or there's been issues like the pandemic that has come out and has created new needs with new solutions. And because ABS has been around, and not just because they've been around, but the contacts that they have, they're actually approached with, hey, this might work with your group of licensees. It's working with some of these other doctors. It's working for some other people. Would you think you could add that into your suite of services? And that's what you're going to find out. One of the ways you're going to find out some of the exact needs of that doctor is to do what's called a practice analysis. And Patrick, you might want to kind of walk through what a practice analysis really is, and because this is really where it begins, because this kind of takes the selling out of working with a doctor.
That's a good point, Eric. We actually have taught people who got into our business that had a background in marketing or sales, and we tell them, look, you've got to forget just about everything you know about sales because there's nothing here that you can sell the doctor. They either need your help or they don't, and the only way to find that out, my wife and I found out back when we were doing it, is to ask them a lot of questions. So we've developed over the years, I think it's 3 or 4 pages now of this practice analysis. All it is some questions that you'll be asking the office manager and or the doctor themselves to get information about where they're at currently right now. So folks, this is more of a consulting gig. That's what this is. You're a consultant to the doctor, and you're there to help them only if they need the help. And if you have anything to sell, it's just more revenue, more money. Now that's a pretty easy thing to sell in today's market out there. But anyway, there's the questions. We've come up with those. You go through those. We teach you exactly in our training how to ask those questions. And then once you go back to your office, you see, you don't do any closing or selling when you first visit the doctor. You get this information, you take it back to your office. We'll show you how to develop using our special software, spreadsheet type software that shows you exactly where to plug in those numbers that you got from that office manager. Once you plug those in, you'll see at the bottom here of this particular example that we blanked out the name of the doctor, of course. We were going to save this doctor $321,000. Well, I should say not save them. That's increased revenue per year, increased. And so if you were a doctor and you saw this, Eric, wouldn't you look down there and go, hey, maybe I should at least talk to these people, huh?
Absolutely. And folks, keep that in mind as we go through the presentation today, because once we get to the newer solution that ABS wants to share with you today, you're going to find out why would a doctor not want to do business with, because all you're doing is providing them a new resource for money that is theirs. That's what I think. If you can start to understand that all you're doing is recovering money that is for them or helping them find that money that's for them, of doing things that they would normally do anyway. Patrick, that's what it gets down to.
Yeah. Hey, as these comments and questions come into the question box today, folks, I want to address them just briefly. Pamela's asking how much is the startup cost. Now, Pamela, that's all covered on our website, which you can see at the bottom of all of our slides there. I think it's hidden on this one, but it's absystems.com. Anyway, go out there and you'll find out more about it. Now, we don't do any real selling ourselves, even on these webinars. This is an educational webinar, so we're not selling anything, but you'll find that we have an investment that's like it's like a franchise fee. You're going to pay us $28,000 for the training that we have, which we'll go into a little bit later, and all of the support and marketing materials and things that we've developed over the years. So basically, you could do all this yourself if you had the time and the money and the know-how. We just put it all in one box, and that's what we sell is a license fee. That's a one-time lifetime license fee. Then after that, you don't pay us anything, never again for anything.
You bet. Let's see. And Reginald says that he agrees with your comment earlier about doctors are not great business people. So
yeah, anybody who's worked for a doctor will agree that that's true. They're just not. They're smart. Obviously, they know a lot about taking care of patients, but that does not mean that they know how to run a profitable practice, which is what we're there to help them with, or you're going to be there to help them with.
So folks, again, just kind of getting back to this report, again, what Patrick and I want to stress to you this afternoon is this: there's really no selling. If you really dive into this, because I think a lot of people come into the potential of getting into any type of enterprise or way of what they're trying to do, you're not really in sales. You're a consultant. You can show the doctor some found money. If you can prove that you can do that with a successful program, a successful system like ABS has, then you're going to find out that you're no longer selling. You're just providing doctor information saying, hey, what if we could recover at least half of that money? You know, what would another $150,000 do for you in that? And you can prove that. In our reason I say we can prove that even before the doctor starts. Someone from ABS's support team can actually get on with your doctor and do a live demonstration based upon their numbers, showing the doctor how we can help that doctor get to these numbers. So really, that's what you're learning. That's what you're getting as part of your system from American Business Systems here. So, you know, what we want to move into is kind of like what would you be doing to earn this type of living? And so, Patrick, I thought it would be kind of just interesting for us to kind of take a little bit of a tour of kind of going, okay, what would an individual really be doing for the medical billing side of it? Some of them may know, some of them may not know.
Yeah, so it starts with our complete integrated system, folks. We have the only system that's out there that's totally cloud-based. That means it exists in the cloud on our servers, which means you can run this business from any computer in the world that has an internet connection. You could log in from the beach of in Hawaii, I guess, if they went to Hawaii, if you wanted to. And that includes, of course, our practice management system, which is what you'll use to actually keep all the records and do the billing for the doctor. Then we have the electronic medical records system, which is on the doctor's side. That is, the doctor will be able to use that to actually put in the information about each patient and maintain all of their records online electronically without any paper. Then, of course, we mentioned that we had the clearinghouse that's built in as well, that is the claims scrubber and that submits the claims for you to the insurance companies. You know, they all want to see it a little bit differently. So that's one of the purposes of a clearinghouse is to handle that. And then you got the patient portal, which some of you may have used that your doctor has now. These patient portals are wonderful, Eric. I use one with my doctor, and it has everything built into it that I need. All my medications, all my appointments, all the notes and records and questions I've asked. It's just a fantastic way once you start using these to maintain your records with the doctor.
Absolutely. And again, this is folks, let me share this. I mentioned to you just a while ago that one of the system aspects of ABS that you get is that our training department, our support department, should I say, will actually get online with your doctor and do a live demonstration. Now, if you, in your due diligence, haven't done a live demonstration of our system, let me encourage you to get back with the person that asked you to come to the webinar today and schedule a live demo of the system that Patrick is talking to you about. they're going to show you what iClaim can do. They're going to show you what the EMRX can do. They're going to show you what the clearinghouse will do inside of there and how the patient portal works. So please get that on your list of things to do. Now, talking about things that you would be doing as a medical biller, in the olden days, the doctors used to have this thing called a super bill. Doctors don't hardly even use super bills anymore. That what they use are just electronic devices, iPads, their phone, their computers. But what you would be doing is taking this, and some doctors still use a super bill, don't get me wrong, but there is an electronic version of this that will be shipped over to you to actually do the billing. And it's going to have all of the information on it, just like what we said here. Here's a diagram of our system where the doctor is using our EMRX system. She would be in there meeting with her patients, taking down the diagnosis codes, then putting in the procedure codes. And yes, I said all those medical codes there because I wanted to share with you, the doctor is putting in those codes into their EMR system and then getting them over to you for you to do the billing. Once you're in the iClaim system, you'll be able to pull up all of those records of what that doctor has done inside the iClaim system and then start generating those claims. You can see here that our clearinghouse is actually built inside of the iClaim system. So when you're processing these claims, Patrick, these claims are being scrubbed and they're making sure that everything is where they need to be. So when one of our licensees actually hits the button to create the claim, it's not going to some third-party clearinghouse. It's going directly to each of the insurance companies, whether it's Medicare, Medicaid, Blue Cross Blue Shield, Aetna, whatever they are. They're leaving our iClaim system going directly to those insurance companies to get the doctor paid. You can't do it any quicker than this.
No, Eric, I think that's why a lot of people get confused getting into the business of doing medical billing. They start seeing all these things out on the internet about learning how to not just do the billing, but the coding as well.
Yes.
And folks, the good news today is this: you don't have to know one single code. All of those codes are built into our system and are suggested to the doctor as they see the patient using our electronic medical record system. So they'll actually be given choices that they can touch and click on there on their iPad that actually puts those codes in so that when they send the claim, it comes to you to actually process and review, and that's when you will see all the codes that are in there. So you don't have to go to coding school. You don't have to get a degree in medical coding. We have certified medical coders, in fact, on staff that can actually help you if the doctor needs help with their codes. That's another one of our ancillary services that you can offer to the doctor.
Now, let me share with you, I've got this in screenshots, and I mentioned to you earlier that you're going to want to get back with the person that's actually invited you to the webinar today to go through a live demonstration. What we're going to do, we're going to step with you right now through a screenshot demonstration that we've kind of got pulled together here. And I'm just going to take a couple of minutes here, not even probably that long, but kind of walk you through it. So let's say that that doctor seen a group of her patients. All that information has come over here into your system now. You're just going to click up over here so you can get to those claims, get to those charges that the doctor's put in there. Go over here to where it says professional claims charges, and then all of that information. You can already see down here in the left-hand corner that there is an R05. Well, that is what's called a diagnosis code. Well, that didn't get there just by itself. It got there because the doctor put that there in her EMRX platform. Well, since our platform is, again, the same system for our billing system, obviously there's no delays in getting that information. Literally, you could do billing in real time. But once that information's in there and you're going to check out everything else that that particular doctor has put in there, you're going to come down and click on Create Claim. And Patrick, just as quickly as I've gone through basically these couple of screenshots, someone has just created a medical claim.
Yeah. So when people wonder, well, how much time is this going to take? You just saw it. A few clicks on the screen in our system, and that claim is submitted. When it says create claim, that's actually creating it ready to go through our clearinghouse that's built into the system. So it's a fantastic, you've got to see this to believe it, folks. Look, most software doesn't even come on CDs anymore. They're
Right.
obsolete, Eric. I don't even have a slot to stick it in here on my Mac computer. So this is old-fashioned, folks. If the company that you're talking to about getting into this or buying software says anything about a CD, you should run as fast as you can, because that's old technology. Ours
Yeah.
is totally 100% truly cloud-based, which means, just like Eric said a moment ago, it's in real time. You're getting the information that the doctor drops in there in real time. You could be at your office seeing the information that appears in your system that the doctor's putting in live. Oh, Eric, I don't know how to explain this. That's why we encourage you folks to get back with the person who invited you to this webinar.
That's right.
We call them your business consultant, development consultant. Just ask them for a demo, and we'll get online. We'll take the time whatever time you want to take, half hour, an hour, answer all your questions. And folks, we don't do any selling. What we do is try to give you all the information you can possibly get about our system to make a wise decision.
Absolutely. All right, so now as we're kind of coming down to the bottom of the hour so far, let's get down into some potential return on your investment. And kind of getting back to, I think, Pamela's question earlier, she was asking, how much is it to get started up here? Actually, you want to talk about the actual fee to get started here and what it's all supporting. Then we're going to start showing how they can get that money back as quickly as possible.
That's right. And Eric, on that next slide, if you'll show that, they can see up at the top. This is our website here, folks. If you go up there under business package, you'll actually see that there's a section called what is the investment? And you'll see why our investment is as low as it is. When I say low, folks, to get into any business nowadays, any franchise, you're talking sometimes $50,000, $100,000 to get involved in just the franchise fee. Ours is very low. It's under $30,000 because we want people to be able to get into this, and the more people we have out there billing, the more money we make as a company, of course. So now Eric is here at this screen, though, because when we talk about ROI, the return on your investment, let's see how long it would take you to return the $28,000 license fee that we have.
You bet. So you could just come over here to the website, go under income potential, and go under medical billing income calculator. That's where we're going to go. And you can see that we've already got numbers built inside up here. So we're looking at one doctor. Again, that's all we want to start with. We're not going to wow you with, if you had 25 or 50 doctors and kind of showing how much money you can make there. I mean, obviously, if you can take one and then multiply it to however many you want to go from there, all it does is either going to double or triple or whatever you want to do. But one doctor that's going to see a good minimum of 20 patients a day. Even with COVID now, doctors are still seeing about 20 patients a day. They're open 5 days a week, charging that 7% of $100. And everybody knows that's a low amount for an office visit. I think my wife had to do an online visit with a doctor, and it was more than just that, just for online. So we're kind of being very conservative here.
Very conservative numbers. Yeah. Now on our website, we'll show you in a minute that the website actually has, I think, 5 doctors, because we want to show you the potential that's there. Folks, we have people who have 15, 20, 30, 40, 50 doctors,
Sure.
But we're starting with one here to kind of make the math simple.
Yeah. So you submit that, and you can see right off the bat that your yearly gross income is going to be right at $36,400 serving one office. Now, Patrick, that's about a little over $3,000 a month for one doctor. And, for one doctor, that's pretty impressive, because when you find out how much time it's going to take for you to make that $3,000 a month, it's going to really be exciting about it.
Yeah, because it's just, you might be talking about 90 minutes in a day to earn that kind of money, because one doctor, 20 claims in one day should not take you more than an hour and a half, 2 hours, let's say, at the most, if you take a break to go to a refrigerator.
So we're going to kind of just show you how the math works so that you can see that there's no smoke and mirrors. Again, this is showing one doctor seeing 20 patients a day at $100. That comes out to about $2,000. If you're doing 7%, you're making $140 a day. Again, for less than 90 minutes a day of doing that. You take that again, multiply that back out. And again, this is all in your handout. So if you want to go back and look at this, you can certainly do that. But you're making $140 a day Again, if it takes you 2 hours a day to do that, well, that's $70 an hour. You can even go out and get part-time work for $70 an hour. So imagine that you're doing this and making, an additional $3,000 a month. That's $700 a week times 52 weeks. That's $36,400 a year. That's
okay. So there's your return on investment, right? Remember, our license fee is only $28,000. Let's say you spend another couple of thousand. Maybe you don't have a computer, or you need a cell phone, or I don't know what else you'd spend money on. Maybe some marketing stuff. But the point is, folks, that you could earn all that back in less than a year with one client. Now, let that sink in for a minute. Not many businesses have that ability to have that recurring monthly income from a doctor, because they're going to see patients right every month, and so you'll be billing every month and making that kind of money, and it mounts up very quickly.
Yeah, you bet, and very fast, because we're going to look at 5 doctors. Patrick said that our website already has 5 doctors. So again, if you haven't done that calculation as quickly as we can show you right here, the only number here that we've done is change the 1 to 5. We're going to hit submit. Now you're going to jump up to $182,000 a year. So you can see quickly how quickly you can get to a 6-figure income. Now, obviously, at 5 doctors, if you're taking that times 90 minutes a day, then you're going to be at that 6, 7, 8 hour a day job. I mean, but you're making $15,000 a month. By this time, you probably have already got somebody working part-time for you. So you can see that you can even afford to do that at that point.
Yeah, so $182,000, folks. Let that sink in. Even if you had some hidden costs there, I don't know what they'd be if you have your own computer already, maybe a printer. You have to have, you can have virtual fax, of course, so that things that are faxed to you come to your email. But the point is, you might have some hidden expenses there that I'm not thinking about, or even some advertising costs. If you're going to spend money doing any kind of marketing, you might have some costs, even though we include over 2,000 marketing pieces in our initial package that's sent to you. The point is, you still could be making your 6-figure income working from home in your underwear. I mean, pajamas.
Or whatever you want to be wearing,
Right.
working from home.
Hey, Leon is asking how many people nationwide are using the ABS system. Well, Leon, let me just say this. We have been doing this for 26 years. So yes, we've got hundreds of licensees from coast to coast, literally about 600 that are out there actively building their business. But if you break that down for the entire United States and the number of doctors, there's about 1 million medical providers. We haven't even scratched the surface yet. There's plenty of business in every area that's in there, especially when you just saw that with 5 doctors, you could be making the kind of money that most people dream about. If you've got more than 5 doctors in your area, then you could have several people probably in your own area. But Eric, the funny thing is that even though we've been doing this long, the United States is so big that we're just not anywhere close to saturating any market that's out there. I think that's where that kind of question comes from, Leon. I hope that helped.
Yeah, and Urban's asking the question, why not look at dental offices as well? And you got a question there, and maybe even a statement there, and I'll address both of those. It's a good question. A lot of people do ask whenever we talk about what we're doing here about why not dive into the dental billing. I'll tell you why, Urban, because one of the things is dental billing and medical billing are actually 2 separate types of codes completely. And we know that what we want to strive is that you get really good, obviously doing something right within a certain service line. Now, after you've conquered and you're really good at medical billing, then obviously jump into dental billing. But I'll also tell you that there's not as much money to be made. You're not looking at the same type of numbers that we're looking right here in the dental billing area. We've got this pie chart that's not even created by us that kind of shows you the breakdown of how much money is in the medical field, which includes dentals, and the comparison of PCPs and specialists that are medical doctors versus the dental practices is
No
enormous.
comparison.
Yeah,
Right.
it's just so if you're just going to start to narrow down your marketing bandwidth whenever you start to do that. So nothing against dental billing. If you so choose want to do dental billing, that we would say, yeah, do it. Go out there and do it. What we do best is medical billing, and hopefully that's satisfactory enough, because we're not split off into doing some things that we may not be comfortable with. But I also ask you to kind of hang on here, because what goes hand in hand with medical billing is what Patrick and I are going to be sharing with you here towards the end. And I can tell you that any other competitors out there that are doing medical billing as software as a service out there do not, and probably are not even engaged with some of the other services that we're about to share with you about. So just hang in there, Irving, and hopefully that'll help answer some of your questions. So hopefully that answers your question just as honestly and as transparent as we can be, that what, we don't do dental billing. Now, we do have dental billing software that if you want to go out and do that, obviously, Patrick, we know that we have that, and so that service is actually out there. I don't want to say that we can't support you in that, or at least provide the program for you to be able to do that. It's just that our focus is obviously on medical billing.
Yeah, we want you to go after the biggest market that's in your area, and that's the medical billing. That's where the money is. Go for the money first. Once you've signed up all the doctors in your area, then you might think about going and calling on some dentists that are out there, but that's not a profitable. There are companies who include dental in their package, so to speak, Eric. That's because they want you to think that they're giving you more value, but really what they're doing is they're diluting your focus on the thing you should be focusing on, which is where the money is. It's in them thar hills where the doctors are.
Well, folks, we got about 20 minutes, and we've got a lot of stuff we want to cover, and we want to make sure that hopefully we're answering your questions as we kind of go through this live with you, and hopefully we're getting those done satisfactorily to you. Folks, there's also multiple streams of income. Now, we say multiple streams of income here within ABS. A lot of these are going to be somewhat what you would think of as door openers. Some are supporting services that you can use for the doctor. I mean, if you kind of look across the board here, obviously you see you got iClaim up there for the billing, you've got EMRX up there for the electronic medical records, but some supporting services. And we're going to go through those. iDocs Now is a supporting service. CodeWrite is a supporting service. AUDITGUARD is a supporting service. Now, each of these supporting services, you can make money, whether it's QUICKCOLLECT, whether it's helping the doctor, make sure that they're getting caught up on some of their things there. Obviously, ComplianceGuard is a supporting service. Telehealth is a supporting service. So can you make money on any of these? Yes. We're going to show you that you can make money on these. They're not going to be as much money as you're going to make with medical billing. However, when you're supporting medical billing and you're using these services wisely, you're going to find out that some of them may be door openers for you. There are going to be some that are going to be supporting income for the doctor. So let's just get right into that, Patrick. We know that QUICKCOLLECT, the doctors having trouble collecting money. That's still an issue out there. Let's talk real quickly about QUICKCOLLECT.
Yeah, most doctors are not collecting, but about half of all the money that's billed to the patients. Now, remember, there are people that don't have insurance, and there are people who don't have even the supplemental insurance to cover what Medicare doesn't cover. So they owe that money. And there are self-pays out there like myself. I don't have insurance coverage. I just pay for whatever, medical services I need. So that money is hard for doctors to collect without turning it over to a collection agency. And that's the worst thing they can do, because they're going to turn off all their patients when they do that. And of course, those patients are going to, by word of mouth, spread the word that this doctor comes after you. Well, our service automates the collection of past due accounts, totally automated. You never pick up a phone, you never mail out anything. This is all done online through the cloud, automatically goes out and collects that money. As you can see, again, get the handout so you can really break these numbers down and discuss these with your ABS rep. But the point is, with QUICKCOLLECT alone, if you just had 5 doctors with that, you could be making another almost $11,000 a year. And folks, you don't basically do anything. Once that's set up, it's automated, and that money is just what I call, Eric, mailbox money. You just basically go to the mailbox and get your check each month for that Quick Collect service.
Yeah, and you can see this with 5 doctors with just 24 past due accounts each. So you're talking about 120, less than 125 per month that you could be making that out of. There's 120 accounts right there. You know, you're making an additional almost $11,000 a year on it. Now, again, like Patrick said, you're not really having to do anything for that. You got the doctor set up on that, and you got them going. AUDITGUARD is another supporting service that can be helpful for you. Obviously, a lot of you may not have medical billing background, but you know that you have enough intelligence to know that you need to know something about medical coding. And so these AUDITGUARD and CodeWrite support you in the codes. Even that, on top of that, you got iClaim that supports you in the codes. But every doctor that sees Medicare patients are always being looked at by Medicare, and you want to have something like AUDITGUARD that will do once or twice a year a spot check, and that's what this is. So you take those five same doctors. Let's say you do 4 reviews per year for these doctors, about 20 reviews, and those are really good. You talk about being proactive with your doctor. This is one of those areas where you're really having the best interest of the doctor, because they're utilizing the proper codes, that they don't come back and get money, what they call in our world clawed back money, or fines that would keep even total up to even more than that. That, you know, here you're going to be able to make another $18,000 a year just with that one particular service.
Yeah, Medicare likes to bill doctors fine. They fine the doctors for any infractions they find, and that could be up to $10,000 per infraction. So it mounts up fast. So that's a great service. Then there's AUTOCARD, folks. This is an automated follow-up system that you can personalize and schedule for the doctor to be mailed to their patients. Automatically, they get a card in the mail, a full-color postcard. It can have the picture of the doctor, their staff, their office. It can be personalized exactly what the doctor wants and goes out automatically. Again, you don't do any printing or mailing. This is an online cloud-based service that's done for you. And you can use it for following up your own clients and customer follow-ups. So Eric, let's show them a little example of that. There you go. You can make another $12,000 based on the numbers that you see here. Now, we're going through this real quickly just so you can go over the numbers with your rep if you download the handout over there of all these slides.
Yeah, Urban's asking, can you expand on that statement that those services support me and when cents and costs are associated? Yeah, I think the cents and costs associated, Urban, is obviously we're not going to have the time because we want to get to this last one here. We've got about 15 more minutes of the webinar. That's what Patrick's saying. Download this, work this with your business development consultant here with ABS. They're going to go through each and how they support you. I mean, again, they could be door openers, they could be a lot of different things, and again, supporting you in the medical billing. Here, you know, you talk about real estate. Real estate is expensive. Real estate in doctor's offices is very pricey. And imagine having to store 7 years of all of their patients' records. Now, this is for doctors that are still using paper, and you're going to find out that a lot of doctors still out there using paper, but they need a safe way, a HIPAA-compliant way to store this. That can be done through iDocs Now. It's not electronic medical records. This is a document management, a HIPAA document management program. Again, here you sign these doctors up for that. There's another $6,000 in revenue for you. And then lastly, CodeWrite is another supporting mechanism so that let's say, Irving, let's take this one for instance. Let's say that you sign up a surgeon. Well, a surgeon doesn't do their notes on an EMR system. They're going to be doing their notes as they're doing their surgeries, and they've got it recorded, and they need a transcriber, and then all you're doing is getting all these notes. Well, you could actually take those notes, run them through CodeWrite, and our certified professional coders will take those either written notes or recorded notes and turn those into actual procedure codes and diagnosis codes so that you can do the billing. That's hopefully a way that you can see how this is going to help support you. But even with that, you got 5 doctors that need 400 reviews on that. You're making money on top. That's $12,000 a year. So again, taking all of that and combining all of this with 5 practicing doctors that you're doing billing for. You got each of these doctors on 1 or 2 or all of these at one time. And this is going to bring you, that's okay, wait, how long is this thing? What do you get this thing for? Here he comes.
That's some fancy animation.
I'm telling you, it's some fancy animation.
Takes way too long.
Yeah, $240,000 there. So, almost $250,000 there. Well, actually over $250,000 in revenue to you as a licensee.
Yeah.
Pretty good money for being, and of what you could potentially make in there. Now, Patrick, we've got less than 15 minutes to get through this, because this is where you and I, from the very beginning, wanted to get to. Adam is our president of American Business Systems, and he ran across this particular article that came up on the web, and you can see it just December the 8th, using telehealth for a more effective continuum of care. Now, folks, let's just talk real briefly. We know telehealth is out there. We have telehealth support in 2 different areas, inside of our system and outside of our system. However, it's that last part that is the most important part of this title. It's the continuum of care, where everything's going currently, and this is where ABS is on the cutting edge of technology, and that's where we're getting into virtual care. Patrick, my hat's off to you for everything that you do, Adam and the rest of the crew here, for searching and researching some things out there. But because of this pandemic that's occurred, this has exploded a lot of innovation out there in the marketplace. And now, instead of the patients having to come in for regular blood pressure readings or for glucose readings, that would be your blood sugar readings, monitoring people with certain chronic diseases, all of this is now being done, guess what, remotely, and Medicare is actually reimbursing the doctor for that. This is a beautiful thing.
Yeah, so think about it this way, folks. Anybody can do telehealth. Telehealth is just using Zoom or any of the other platforms that are out there to have a face-to-face, video conference with your doctor. But what we're talking about here now, and what this article is talking about here out of the Physician Practice Magazine, has to do with all the continued care that a doctor can do with their patients. How do they do that without having to see the patients in their own office? Well, they can do that through telehealth, as a part of telehealth at least. And Eric is showing you one of the flyers, for example, that we have developed for this particular service. But basically, it's to take better care of the patients and bring the doctor revenue. Wait till you see the kind of money that this can bring into a doctor's practice and what it can make for you as one of our licensees who's offering this service.
Well, let's before we get into the numbers here, first of all, remember, when you go through our training, you're going to be certified as a certified medical revenue manager, which means that you're more than just a biller. You are finding areas of ways that you can help that doctor recoup money or increase their revenue. And as long as Patrick and I have been in this business, we really have a passion for independent doctors and making sure that they get paid. And this is one of those areas in which we can show the doctor, without them having to add any staff, they can outsource all of this outside of their office, whether it's annual wellness visit. Now, an annual wellness visit is not the same as an annual checkup, okay? An annual wellness visit inside of Medicare is making sure that the patient is assigned to certain doctors and they've got everything that they need. While they're doing that, they can do what's called an advanced care plan, which means for all of their legal documents for what you would think of the end of life. All that can be done once and twice a year, and the doctor gets actually reimbursed for that, for doing that for their Medicare patients. Then with the elderly, most elderly people are on more than 2 chronic conditions like diabetes and high blood pressure. That would put them on monthly patient check-in calls, medication management, care plan compliance, care coordination services. That too is reimbursable. So you can see, as you kind of go through all of these, and you can see the next to the last one down there, remote patient monitoring, These are daily monitorings with certain devices. And you talk about leading edge technology. We're not talking about a device that you just go pick up at a big box store and then put it in your phone. We're talking about a blood pressure cuff or a glucose meter that once the readings are done, those are sent automatically via the cell. They're not even going through. So imagine an elderly person that may not have a smartphone. How are they going to get that information to the doctor? Well, that's done through it's called a cell-enabled device. So that goes automatically. So let's talk about what it does for the doctor. Imagine a doctor has 250 elderly patients that they're taking care of, and they need to make sure that they can have enhanced care, they can improve the outcome of those particular patients, and then by doing those two things, they can actually increase their revenue. Actually, this is where it gets really exciting, and again, I'm proud to be working with American Business Systems on this, because there's not another medical billing franchise / business opportunity that has this even in their scope of work.
Yeah, and folks, we didn't mention this, but I think I hinted that this is one of the services that we've just developed. It hasn't even been introduced completely to our licensees that are currently with us. This is a 2021 service, basically, that will be rolling out big time right after the first of the year. So you're getting a preview of this, even though you're not a part of our network at this time, you're thinking about joining us. We wanted to show you the estimated economic impact for the doctor and you with this one service alone.
So let's get to the doctor. This is how much the doctor can make by having a patient, let's say one patient, on chronic care management and remote patient monitoring once a month throughout the year. So the total increased annual revenue per patient to the doctor is going to be roughly about $840 per patient per year. Now you're thinking, okay, that's decent money. And remember, the doctor's not doing anything, because this is all being taken care of not only by the software, but the partnership that's been with ABS. That group has its own call center of certified medical assistants, RNs, LPNs. All of these people are certified professional, the nurses, and being managed even by doctors on top of that. So this is even after the fees are even taken out. So you take an estimated 250 patients from each of these doctors here, and for let's say that one of these doctors has 250 patients that they want monitored throughout the year, and if you do any billing, if you go do your practice analysis, you're going to find out that a lot of doctors are probably about 60 to 70% Medicare billing. So getting to 250 patients in one doctor's office is not going to be difficult. But just with that, the doctor can generate nearly an additional $210,000 a year for having their Medicare patients on these services. And again, they don't have to hire additional staff. They don't have to pay for the software. This is with all fees taken out. This is their bottom line out of that. Patrick, if I can't sell this to a doctor, I don't know what else I could be doing.
Yeah, Dr. Jones, what if I could show you a way to bring in another $200,000 a year, and you really don't have to have anything extra? No extra space in your practice, no extra staff, no extra equipment. It's all done for you by professionals through telemedicine. They are just going to flip out, Eric. Hey, by the way, this kind of addresses Jitesh. Jitesh asked the question about, can you share the costs that are associated with all those revenues that we showed earlier? Folks, those revenues that we show, including this one, are including all the fees that the doctor is actually paying to have all this done. This is a net figure. Basically, $210,000 is his bottom line number that he'll get just for engaging with you on this service. Well, just the two services you see listed there: chronic care management and remote patient monitoring.
Now we're going to show you and wrap this thing up with what's exciting to me. this is what you're going to be making. Your estimated revenue per patient is going to run about $12.50 per patient of what you're making out of that. Remember, you're not even doing the billing for this. And imagine you've got, you know, you're making $12.50 times 250 patients per month. That's generating $3,250 a month for you, with a yearly income with one doctor at $37,500. Now, Patrick, when we did the billing work a while ago, we kind of broke down the numbers with one doctor. Imagine you doing billing for one of those doctors, and you've got the doctor on virtual care. You're already close to $70,000 a year with one doctor. And you talk about in getting your ROI within your first year. There's no other business opportunity out there that I know of that can get your ROI in that amount of time.
Yeah, Eric, as you know, I thought long and hard about this particular service that we can offer to doctors. We could hire a sales force to just go out and sign up doctors on this all day long, because there's no selling when you were talking about increasing their revenue by $200,000 a year. So, but we've decided instead, folks, to offer this to our licensees. Remember, all these services that we research and find for our licensees, we offer it to them at no additional cost, by the way. When we roll this out next year to our current licensee base that's out there already, they don't pay anything extra for this.
Right.
This is all included in whatever one-time fee you pay us, the $28,000 at this point. And Eric, that ought to go up next year, by the way. But $28,000 is a great investment when you have this kind of potential. Eric, this is what I call more mailbox money right here, because the licensee is not doing a thing to earn that money on the back end there. So add that to whatever total we had, the 240,000 was it, with all the other services, billing and all the other services. Add this one to that, and now we're up to about 280.
And then you got, let's say you get all 5 of your doctors on this on top of that. I mean, and then you're doing the billing for those doctors. I mean, you're at $500,000 right there in revenue for yourself.
Yeah.
So
Yeah.
again, it adds up fairly quickly. It all starts with your training, live training. I don't think there's any slots available for the rest of this year. So it's all rolling into 2021 anyway. So, but we want you to get started and get started soon. And you've got coaches, you've got people to help you instruct it and all that. I know we're going fast because it's already like 5 o'clock over here where we are, Patrick. Let's talk to them about your 100% money back guarantee.
Yeah, folks, we're the only franchise / business opportunity licensing opportunity that I know of that offers 100% money back guarantee. And all it means is this, that if you go through our training and in the first 30 days you decide, you know what, I think I made a mistake, this is not a good investment, the business is just not right for me, we'll give you 100% of your money back. Ask your ABS rep more about that if you'd like the details on that. But yes, we have offered money back, and we've given some money back, less than probably at 0.5% of all the licensees that have come through our training. So that tells you that we've got something that's pretty solid, pretty reliable. All the training is done online, and we'll talk a little bit more about that as we go through these steps. There's 5 steps that you need to take. Number 1, you need to look at our downloadable research guide. Now, folks, this is a 50-page guide that we've put together. It's got information that's not anywhere on our website. So you have to ask your ABS rep, the person who invited you to this. Just email them back or use the phone number in the corner there and just call our office and say, who's my rep and how do I get that research guide? That's what you're looking for. Then go out and look at our YouTube channel. We have one there called youtube.com/whyabs. It has other testimonials and a great library of stuff that we've done over the past 12 to 15 years. Then ask your ABS rep for an owner reference list. Look, Eric and I could be telling you anything about this business, but if you call some of the people who've been through our training, paid their licensing fee, and now have their business up and running, they'll tell you the facts about it. And we've got dozens of people that are willing to talk to you. A live demo, Eric mentioned that a couple of times. Be sure and ask your ABS rep for that live demo of our system if you want to go through it step by step and ask all the questions you want. And then just lock in your first online training session with your rep. Tell them, I want to go ahead and lock in that first training session, even if you're still doing your due diligence.